We come back to the studio. We're on Thursdays. We always talk with someone from the medical community. Today, Dr. Michelle Fillion, a surgical oncologist with New Hanover Regional Medical Center's Zimmer Cancer Center. You'll never know this at home. She smells fantastic. I've already told that. All right, so we wanted to talk this morning. We're going to talk about breast cancer, but we were talking off camera. There are some new things that we want to hit on right away.
Yes, importantly, this really comes down to screening. So there are some changes in the recommendations for screening. American Cancer Society has now changed their recommendation. Instead of necessarily everybody starting at the age of 40, they've pushed it to the age of 45. Okay. However, it leaves some give room for the women that are between 40 and 44 to really talk with their physician and assess their risk factors, because there's still also the American College of Gynecology and Oncology that has really focus on doing screening at age 40 as well. So there still is some give room, but there has been some changes in the screening recommendations.
With a pushback like that, is it because there have been so many advancements now with the research for breast cancer? There
is, and what we're getting better at diagnosing and better at treating, and that we're finding that sometimes we're almost over-diagnosing the breast cancer, some very small breast cancers that may not have any clinical significance down the line in regards to survivability. One of the new things that we have is a 3D mammogram, and we actually have that offered now in Wilmington. What that does is it increases the risk of identifying breast cancer, and especially women that have dense breast tissue.
As far as the indicators, if there's a woman at home that maybe has done the self-exam, maybe has felt something that they think is a lump, how quickly do they need to act? I mean, obviously, it's not something that you want to sit back, we'll take care of this in a year's time.
As soon as you notice something that's just different, hasn't been there before, it's different, doesn't feel quite right, call your primary care doctor, get a mammogram. That's the biggest thing that can be done. They may call you back to additional mammogram images and ultrasounds, but that's the very first step of getting early detection of breast cancer.
One thing I wanted to ask you, and it wasn't on the talking points, but I trust you here. When a woman hears the diagnosis, you do have breast cancer,
yep,
obviously there's a psychological toll.
Oh, yeah.
At the hospital at New Hanover, how are you equipped to handle and helping women get through this?
Well, it is a very trying time, and it's one of those cancers that really just strikes home to women. It really affects the femininity, and it's a gut-wrenching diagnosis, probably more than any of the other cancer diagnoses that we have. So we really sit down and we take very long time. I'll have at least an hour with a new breast cancer patient, and we discuss in depth what is the diagnosis, what's the survivability, what are the treatment options, because there are varied treatment options when it comes to different surgical procedures, possible need for chemotherapy, radiation, and hormone therapy as well.
Just such a good facility over there. You're a recidivist for a good reason. Such a good guest. We're back with more after this.